Hello everyone, welcome to my channel for nursing exams learning. Hope you are doing well and preparing well for your exams. So in this video we will discuss schizophrenia. This is one of the important topic in mental health nursing, and we know that especially for the English RN exam and some other exams we can expect around 20 to 25% of questions from this mental health aspects along with the pharmacological things related to the mental health nursing. So we'll start with the schizophrenia along with some practice questions and answers. What do you mean by schizophrenia? In the schizophrenia, if a client is diagnosed with the schizophrenia, they have certain symptoms like that we call it as psychotic features. They have hallucinations. Hallucinations, maybe it might be an auditory hallucination or a visual hallucination, and they have delusion means it's a false fixed belief and that is real to the client. If we try to make them it is not real, it will not be going to work. They will not accept that, because as for them they think that the thing what see they listen it is real to them. So there will not be any logical reasoning or logical classification to that particular belief. It's not going to change in their mind. And the client usually they have a very disordered thought process. They couldn't manage their thought activities, and they have a very difficult interpersonal relationship because it is disrupted. They couldn't make a good therapeutic relationship with the healthcare professional. So these are some of the common psychotic features that is related to the schizophrenia. I know it must be a very difficult topic, and while we are studying, you could not be able to catch all the points at a time. So just we will have a brief and we will move to the question. That's our plan for today. Then what are some of the clinical features that is related to schizophrenia? And the schizophrenia, we said that the client they have hallucinations, delusion, and they have some problem with the language and communication. An inappropriate affect. What do you mean by inappropriate affect? Like there is a situation and that is entirely a happiness moment, but this client they might be start to cry because it is inappropriate to that particular situation. Their affect or their emotion is inappropriate to that particular situation. Then impaired thought process, that we already said that. Then compulsive rituals, like we studied in obsessive compulsive disorder or OCD. We know that the clients they are doing some activities again and again. Might be they want to wash their hand and they will do that is for around 1 hour. They think that the hand is not clean. That is a compulsive rituals. Then inappropriate or bizarre motor activity, like very strange unusual motor, like a catatonic stupor, especially in unconscious, that is stupor unconsciousness. Then neglecting the physical needs. Most of the clients those who are diagnosed with the schizophrenia, they may not have a proper a balance in their attaining their physical needs, and a feeling of unsafe. If they will see someone near to them, or if they will go society or somewhere, they will see some people, they will think these people are coming to attack me, or they are standing in a situation which is very threatening and that is unsafe for them. So these are some of the clinical features that we usually see in the client who is diagnosed with the schizophrenia. I hope it's clear. I don't want to make it a very elaborative discussion because it will take a long time. Better to go through the questions so that will be more easy. Then what is the causes that might end up or that might develop schizophrenia? As per the present studies, the exact cause of schizophrenia is unknown, but there are certain theories, or there are some genetical combinations are connected with the development of schizophrenia or the causative factors of schizophrenia. The research studies indicate that the identical twins have about 50% of getting disease if one twin get schizophrenia, or one twin developing the disease of schizophrenia. But we couldn't say that the disease is entirely genetical. There are chances, but we couldn't say it is totally a genetic disorder. Then in most likely the results from interaction and combination of a different factors or causative agents. It is not a one thing or particular some points or things that will results to develop schizophrenia. There are group of factors. That's some of the theories that we said, biochemical theories. In biochemical theories, main things are abnormalities affecting the neurotransmitters. We know that the neurotransmitters, dopamine, serotonin, then norepinephrine. So these, any changes or any abnormalities in these neurotransmitters that will be a chance of developing schizophrenia. Then structural brain abnormalities, like a reduced size of the scalp or the brain areas. Then developmental factors like prenatal factors such as faulty neuronal connections. Then like some other miscellaneous factors that we call birth trauma, maybe epilepsy, and mother, she might have developed maternal influenza during pregnancy. So these all factors or these all points have some connections to schizophrenia. So just keep these points in your mind, because in some questions they might be pick up some of these options as the question option. So if you have an idea, it is easy for you to choose the correct one. Then we will see what are some of the type of impaired thought process or speech alterations. We know that when we treat a client who is diagnosed with schizophrenia, they might be show some of the very different features or the speech alterations. Based on that, we can decide, okay, what is the stage and whether it is a positive symptom or it is a negative symptom. The first one, that is neologism. When you see such kind of words, you might be feel a little bit difficulty. So try, whenever you will see such words, try to split those words or try to make some connection with that words, so it is easy for you to remember. Neologism means like new words. Neo is like new, like a made up words. They will make some words and that words have only meaning to them, only meaning to the client, only have the meaning to that particular word. For example, I would like to have a fish nose. So we don't know what is the meaning of this fish nose, but as per the client thought, they have some meaning to that one. Then another one is concrete thinking. Like the client have some problem with the abstract thinking, and they will make some phrases. For example, a grass is always greener on the other side. Actually, they are trying to interpret the meaning that the grass have a green color, or the grass is literally greener. That is the one they want to interpret. But because of the problems or difficulty with the abstract thinking, they are making in a different phrase. Then loose association or flight of ideas. Flight of idea means they will start with one point or they will start with one idea and rapidly they are shifting to different ideas. They couldn't fix with one, or they couldn't express the right thing what they wanted to do. Like it's a rapid shifting from one idea to another with little or no connections to logic or reality. There may not be much logic, there may not be any rationale behind their ideas, and that is rapidly shifting one to another. Then the another one is echolalia. Echolalia that we usually call it as like parrot speak. Like if the nurse, she is talking something to this patient, the patient will repeat some of the words what the nurse is talking, and keep on repeating that word, like a repetition of words usually uttered by someone else. Then the another speech alteration, that is tangentiality. What do you mean by tangentiality? It is going from one topic to the next without getting to the point of the original idea or topic. Okay, client, they have to mention or they want to explain one point, but they couldn't. They are starting with that one and they are not finishing that one. They are going to another one, again another. So, and the main thing or the exact thing what they wanted to express or what they wanted to inform, they couldn't do it that. That is the one, tangentiality. And the word salad. Word salad means that particular word is, you know, that it's a group of words they are making, and most of them, they didn't have much meaning. Like a mix of words and phrases having no meaning except to the client. But always keep in your mind that the things what the client is talking, they have some meaning in their mind. But in reality, it doesn't show any meaning, it doesn't have any meaning. Here the example, like here what comes table, sky, apple. See, when we will listen, there is no meaning, but as per the client, they have some meaning in this one. Then the another one is clang association. What do you mean by clang association? It is like rhyming words in a meaningless, illogical manner. For example, if the bike likes to hike and the Mac put the bike near the tike. See, when you listen, we don't know anything. There is an illogical, meaningless phrases or rhyming words. Maybe you have some, when you are listening this one, you might be some confusion. Okay, tangentiality have some connection with this clang association, or the clang association have some connection with the another flight of ideas, and you might be feel some issues with the keeping these ideas in your mind. So try to repeat and try to understand the meaning and try to study some examples, so it will not make any confusion in your mind. Then another one is perseveration, repeating the same word or phrases in response to different questions. We are asking different questions to client, but he is giving a same answer to all questions, or repeating that same answer to all questions. So these are some of the, see, now we have studied around 8 speech alterations, words or terms related to the impaired thought process in schizophrenia. Just keep these points in your mind and try to review, keep connect with the examples. So in this video we will just wind up here, and we will continue with the next video. In that one we will add some of the medical management as well as some of the treatment based on the negative and positive symptoms. How we can say that the client have negative symptoms of schizophrenia, or what are the symptoms come under the positive symptoms of schizophrenia. Those things we will discuss on the next video, and I assure that we will include more questions. So please watch the videos continuously, and it will be like a series of videos. We have many parts for this particular topics. So bye for now, take care.